We are in the live.
Good morning to all participants.
Good morning to all participants.
Now a welcome note by Dr. Sirisha.
Good morning, everyone.
Sirisha.
I, Dr. Sirisha, on behalf of Seven Hills College of Pharmacy, would like to present a gracious welcome to you all. And I extremely feel privileged to welcome our speaker, Dr. Krishna Garu. Seven Hills College of Pharmacy was started in 2007 as an institution exclusively specialized in pharmacy education. Presently, our college is offering the courses B Pharmacy, M Pharmacy with the departments Pharmaceutics, Pharmaceutical Analysis and Pharmacology, Pharm D and Pharm D PB. And our college is accredited A grade by NAC and accredited by NBA. And coming to the main theme of this webinar, still many students who are studying PharmD and parents are having many doubts and they're having a big question mark on what's next after PharmD, right? So to clear all these doubts, and so the main motto of our webinar is to provide information about various career opportunities after PharmD. Now, without any further ado, we'll start the webinar. But now I request our beloved principal, sir, Dr. M. Niranjan Babu Garu, to give the welcome speech.
Sir, you can start. Please unmute your please.
Om Namo Venkateshaya. Namaskar. Good morning to all of you. I am very pleased to hear today for this webinar topic, Career Guidance for Pharma D by Seven Hills College of Pharmacy, Tirupati. Today's topic will be delivered by most talented speaker, Dr. Krishna Undela, JSS College of Pharmacy, Mysore. Welcome you, sir. I would like to welcome and thank all the registered delegates, friends, students for being present for today's webinar. I would like to specially thank the team of Seven Hills College of Pharmacy for organizing a wonderful seminar. Though this seminar, an individual is given a platform to identify their vulnerable spots, gain of understanding, focus on essential aspects, improve their quality and confidence. I ensure this seminar will be profitable and fruitful for everyone present here. Thank you one and all. Have a nice day. Jai Hind.
Thank you so much, sir, for your valuable inspirational speech. Now it will be a good start for the program. Now I request to Dr. Jyoti ma'am to have a introduction speech on Dr. Krishna Undela.
Good morning. This is Jyoti. So professor and Pharm D coordinator in Seven Hills College of Pharmacy. So I'm very happy to read about Dr. Krishna Undela, today's speaker in our college. So Dr. Krishna Undela has graduated in pharmacy from Seven Hills Sri Vidyaniketan College of Pharmacy, Tirupati in 2010 and completed his M Pharm from the Naipar Mohali in 2012. Thereafter, he started working at JSS College of Pharmacy, Mysore as a lecturer in the Department of Pharmacy Practice. He completed his PhD in August 2019 from JSS Academy of Higher Education and Research, Mysore. Krishna Undela is having experience in conducting various pharmacoepidemiological studies in hospital and community settings. He received travel grants from International Society of various places as an educational session speaker. He also received a travel grant from the ISPOR to attend the ISPOR European Congress held in Austria in 2016. Then he also received 2015 fellowship from the Department of Education Australian government to undertake 3 months of training on advanced pharmacoepidemiology and quality use of medicines at the University of South Australia, Australia. So Krishna Undela is also having expertise in conducting systematic reviews and meta-analysis and published papers in various peer-reviewed reputed journals. So Krishna Undela delivered more than 60 guest lectures at various national and international conferences in the areas of pharmacoepidemiology, pharmacovigilance, pharmacoeconomics, and systematic review and meta-analysis. Currently, Krishna Undela have 50 plus scientific publication in his credit. Total citations of his publications are 700 plus with high index 9 and 10. So Krishna Undela currently a member of International Society of Pharmacovigilance, International Society for Pharmacoepidemiology, International Society of Pharmacoeconomics and ISPAR and Indian Pharmaceutical Association. So thank you one and all. So I will continue.
Thank you so much, ma'am, for your valuable introduction speech. Now I am giving my things to Dr. Krishna Undela to continue the rest of the session. Welcome you to, sir, on the board.
Yeah.
Yes, sir. You can start.
Yeah, I'm just sharing my screen. Yeah.
Thank you.
Can you see my screen, Sunil Kumar? Good morning, everyone. Thank you for attending for today's webinar on career guidance for Pharm D. And before I'm going to start my topic, I would like to thank the management of Seven Hills College of Pharmacy for giving me this opportunity to speak once again with Pharm D students. That is my most interesting part of my career, talking to the students. Thank you for once again giving me this opportunity. Especially, I would like to thank Dr. M. Niranjan Babu sir and Jyoti madam for asking me to speak on this topic, the career guidance. And I'm sure that many times already you could have heard from many people about the career guidance for Pharm D. And that's the most important topic which is going on in the pharmacy sector in entire India right now. As one of the person mentioned already, like the people are in confusion state, especially the Pharm D students, parents, and all other people about their career in the future after the 6 years Pharm D course. So today I thought of taking you through my presentation. It is not a detailed presentation. I just kept some pictures which came in my mind, like what are all the options are available for Pharm D students once they graduate from pharmacy college and complete their Pharm D. So what are the positions maybe they can look into once they complete the Pharm D course? That's what I'm going to take you through today over my presentation. And before going into my presentation, I would like to speak to you just 2 minutes and giving some guidance on, first of all, you should remove the negative thoughts from your mind. And I know that there are many negativities are going on throughout India about the Pharm D course, okay, especially for the career perspective. There are negative thoughts which are going on. I ask you to remove that, first of all, the negative thoughts from your mind so that everything will be very clear for you, okay? And every time I used to hear that, sir, I'm doing Pharm D and there are no career opportunities once I complete Pharm D. Okay. Can you tell me at least any one program or one course which is going to be give us the 100% sure that we are going to be get the job after our course. There are no course such as like that. Even MBBS also, it is not that if the student is not worth, it is not that he is going to be get the job. Okay. So first of all, we should have the talent and we should have the knowledge, and then only maybe we can expect the jobs. It is similar to all other courses are existing. Maybe the engineering, maybe the dentistry, maybe the medical. The Pharm D also is similar to that. It is not that every person who is going to be choose the Pharm D course, there's a 100% guarantee that they're going to be get the jobs. Okay, it is up to us how much we gain the knowledge during the course, and that's going to be give you the path of getting the job. So that we have to be very clear that it is up to us what we are going to be doing. Either it's a Pharm D, or it is a B Pharmacy, or it's a diploma in pharmacy also. Whatever the course you are going to be do, either you are going to be get the job or not, either you are going to be get the correct job or not, it is entirely depending upon you. No one is going to be influenced that. Okay, that we should keep in mind, and that should be very clear. And I'll give you maybe my example. I did not express this anytime. This is the first time I'm expressing that through online platform to any audience. When I have taken, after I completed my B Pharmacy in 2010, and after that I have written CPAT, I qualified, and after that I have written NIPER set, and I got a rank in NIPER also. So during the counseling, I have taken pharmacy practice seat in NIPER Mohali, and that time everyone told me that why you have taken pharmacy practice, what is a career. I was not knowing pharmacy practice only before going to NIPER counseling. Frankly speaking, I was not knowing that there's a course like pharmacy practice. But still, that time my passion was to study in NIPER, whatever the course it may be, to study in NIPER. And I used to like pharmacology, so I thought maybe the pharmacy practice also similar to that. So let me take the pharmacy practice because I want to study in NIPER. So I have taken the seat, and I'm the last person to be in that department, fortunately or unfortunately. And I did not take it as like it is not my cup of tea. I have pursued the pharmacy practice with utmost attention. And during the second year of my pharmacy practice, me and one of my friends, we have learned together the meta-analysis and systematic review. So we could able to publish few papers. And because of that, maybe I got the job in JSS. And before going to NIPER only, I fixed that whatever I'm going to do, I'm going to be settled down in the teaching field that I decided initially. So because of that reason, I was not having any confusion where I need to go once I complete my pharmacy practice. I was not having any confusion. So I thought that I'm going for teaching. Preferably, I'm going to choose the university, the good university, so that I may have a good career. So from the starting of the second year onwards, I started looking for the universities and applying for the universities. So fortunately, I got the job at JSS, and I started my career here. And over a period of 8 years, since 8 years I'm working here, I feel if I look back what I have done in the last 8 years, I'm very satisfied. I'm very much happy whatever I have done in the area of pharmacy practice. Okay, so that was the situation in 2010, and you can see the situation in 2020 now. So there's a complete difference, and the entire thing depends upon me what I want to do. Okay, it is not that no one guided me. You have to do like this. You have to do like this. It is depends upon us. If you have a passion to do something or to pursue something, and certainly one day you are going to be achieve that. Okay, so that confidence you need to have. You don't bother either you are a Pharm D student or you are a M.Pharm student or you are a B.Pharm student. Don't bother for that. Keep that in mind that what you want to be. Make yourself very clear where you want to be after completing the Pharm D course. It is no one expect that all the Pharm D students will be doing a clinical pharmacist job. No one is going to be expect that. At least a pharmacist job. That's also no one is going to be expect. You may be doing multiple, maybe you may be settling in multiple areas once you complete Pharm D. So that area you need to choose before, so that now you can prepare accordingly and then you can complete the Pharm D course. So that's what my thought sharing process. Just keep in mind, the only thing I request you to keep the negativity outside and think positively and update yourself so that certainly you're going to have the future. So before going to that presentation, that's what from my side. Let us see what are the different career opportunities as a Pharm D student you can grab. I'm not sure how many of you are new to the content what I have here, but I kept in mind the first year Pharm D student who joined recently and who may be not even knowing what is Pharm D, and till the 6th year Pharm D student who is currently doing the internship. So my target audience for today is the students from first year to 6th year. And if you know already some of the options what I'm mentioning here, just keep aware of it because already you know it. But my intention is to make them everyone aware, not only the 6th year, even the first year students also should know what are the career opportunities they're having, so that they can keep their mind strong and they can pursue for the Pharm D course. So that's what my intention. And let us see what all the different roles maybe you can play in the society once you complete the Pharm D. Okay. So the first and foremost role you need to play is a pharmacist. Because you are doing the Pharm D, certainly you are going to be the pharmacist. Either you are going to be do the pharmacy job or you are going to be do any other job. First of all, you are a pharmacist because you got the degree of pharmacy, so you're going to be the pharmacist. So that's what the primary role you are going to play in the society once you complete the Pharm D course. And there are three main pharmacist roles maybe you can play in the society. You can be a community pharmacist, and maybe you can open or your own medical shop or your own pharmacy, or maybe you can be working in a chain of pharmacies as a community pharmacist. And you can be the hospital pharmacist. So you can join in any hospital, tertiary care hospital, and you can be the pharmacist in that particular hospital. So we can call you as a hospital pharmacist. Or the main role for a Pharm D student, the community pharmacist, hospital pharmacist, the minimum qualification is going to be diploma in pharmacy in India. All of you are aware of that. So if you feel that you are overqualified for this community pharmacist and hospital pharmacist, you can choose the one which is applicable for you, which is suitable for you, that is a clinical pharmacist. Okay. So for the clinical pharmacist, none of the other pharmacy graduates are eligible except Pharm D. Of course, M.Pharm pharmacy practice people are eligible for the clinical pharmacist. So the Pharm D people, they can rightly choose the career as a pharmacist, that is the clinical pharmacist. So I request all of you to keep in mind this position is one of the important positions what you are going to be choose at the end of Pharm D career. Okay, the clinical pharmacist. And I know the uncertainties are there in your mind. That is, there are no jobs. There are no clinical pharmacist jobs. That's what the people says. Okay, the people who says there are no clinical pharmacist jobs, I request you to look into the websites, look into some of the resources first before saying that there are no clinical pharmacist jobs. They may be saying that there are no clinical pharmacist jobs by the government organizations. That means in the government at present, there are no positions of clinical pharmacists. But certainly there are very good private hospitals are having the positions of clinical pharmacists. I can mention few, like we have Aster's and Aster MedCity, and we have a Fortis hospitals, chain of hospitals, and we have a Apollo chain of hospitals. All these corporate hospitals, the tertiary care hospitals, they are having the positions of clinical pharmacist. It is up to you either you are going to be opt for that or not. But certainly there are positions, but you need to pursue them. We need to look into where are the jobs, and you need to try to apply for those. Okay, so then only maybe you can get it. And at current, there are no government jobs. Maybe in future we may expect the government jobs, but what it is not only the Pharm D, it is for any other course, even for MBBS, even for maybe management, even for maybe the engineering. It is not that all the students who are coming out are going to get the government jobs. Nowadays, it is not at all possible that every student is going to get the government job. Not at all possible. Then why you are expecting the government job for pharmacy, especially for Pharm D? There are no government jobs, but no one is stopping you to work in a company, work in a corporate hospitals as a clinical pharmacist. So that's one concern. I know the second concern, that is a salary. You may be feeling that the starting salary is going to be very low for the clinical pharmacist. I agree for that. Compared to maybe the job what you're getting in the company, the clinical pharmacist job may offer a little bit less salary compared to the corporate companies. I understand that, certainly. But any one thing we can balance here, either your passion or your salary. Okay. So if I want the salary from the NIPER itself, I could have gone to a multinational company, maybe through the placements, and I can join there. I could have earned much better than what I'm earning currently. Okay. Some of my juniors, Even some of my students are earning more than myself, but I don't bother for that because my passion is teaching. Okay, so whatever the salary I'm going to get means whatever the salary means, that should be sufficient for me and for my family, so that I'm going to satisfy with the salary. So either the salary or the satisfaction. I don't think so. It's very rare combination of having both the salary as well as the satisfaction. It's going to be very rare. So because of that reason, at present, you need to choose which one you're going to be opt for it. At least initial career, I suggest you to don't bother for the salary, choose your passion, go to the profession, learn something, and later maybe you can decide where you want to be. Okay. So I feel that if you join as a clinical pharmacist, you're going to be do the justice for the 6 years Pharm D, what you're going to be do. 6 years is not an easy task. 2 years diploma, maybe 2 years M.Pharm, it's very easy to complete, but 6 years, it's a very crucial period in your entire life. Okay, the 6 years. So whatever you are going to do after the 6 years, there should be some justice, like whatever you studied, that should be a replicate. Okay, so in that case, maybe we can say that, okay, whatever I have done in the last 6 years, it is useful for me to do something like this. Okay, I'm sure that that confidence and that satisfaction will come only when you join as a clinical pharmacist. So that is up to you, what you want to be. There are jobs for clinical pharmacists, and maybe if you are interested, you can opt for it and you can search for it, and then you can try for the clinical pharmacist jobs. And then the second one is you can go to the industry. I think that's the one where the majority of the Pharm D students are currently starting their careers in the pharmaceutical industry. So similar to the B pharmacist student and M pharmacist student, you can start your career even in the manufacturing if you are interested. If you feel that that is not the suitable position for a Pharm D graduate, there are many other positions in the pharmaceutical industry where the Pharm D students can work. You can work in a CRO company, like a clinical research organizations. There are multinational CRO companies are available in India, which are offering many positions currently, especially for the Pharm D students and also all the other pharmacy courses. So you can be, when you join in a CRO, the clinical research organizations, maybe you can start as a CRC, clinical research coordinator, maybe you can start your career, and you can be the clinical research associate, and you can be the manager, you can be the project coordinator. So there are many other positions are there in the clinical research organizations, which are mainly working for the clinical trials. Okay, they are the organizations mainly working for the clinical trials. So if you're interested in that particular area of clinical research, maybe you can join as a CRO in CRO companies. Or else we have one more important area where currently most of the Pharm D students have grabbed, that is pharmacovigilance. And many corporate companies are coming and opening the pharmacovigilance positions nowadays. And the Pharm D students are the most apt people for this particular position, the pharmacovigilance. Okay, so if you're interested in the pharmacovigilance, maybe you can go and join in any pharmacovigilance company. Some companies especially may be there for pharmacovigilance. And some of the core companies like Dr. Reddy's, Novartis, they may have the pharmacovigilance divisions in their own company, and maybe you can join in the pharmacovigilance division of that particular core companies. So that is up to you where you want to be. Either you want to be in a core company or you want to be in a maybe the company like a CRO's clinical research organizations. And you can be the even in HUR. It's an upcoming field in India, especially. There's a health economics and outcomes research. It is a combination of both pharmacoepidemiology and the pharmacoeconomics. So if you have a little bit understanding of pharmacoepidemiology and pharmacoeconomics, I'm sure that we have a subject on pharmacoeconomics and pharmacoepidemiology in 5th year. So apart from the syllabus, what you have, if you can get some more understanding on these two areas, pharmacoepidemiology and pharmacoeconomics, you can certainly be grabbed into this HUR position, health economics and outcomes research position. That's going to be the very good one. I'm sure that you are going to have the satisfaction if you go and join in these HUR companies. There are companies. Once again, here you may have the core companies, and you may have other companies, especially on HUR. And once again, you can choose where you want to be, where you want to go and pursue your career in the platform of HUR, health economics and outcomes research. And also there are many other positions, like you can go and join for the drug regulatory writing, That's what you can call as a writing, regulatory writing, or maybe you can also join for the medical writing. So these are some of the positions maybe the Pharm D students can choose in the pharmaceutical industry. And right now, as per my understanding, many of the Pharm D students are joining in one of these areas and pursuing their starting career. And once again, here there are many options to join in pharmaceutical industry that you need to choose where you are going to be. Okay, don't go that okay, you got a job in CRO and you want to just go like that. First of all, think what is the job profile. Either you are going to be liking that position in the future or not, and then maybe you can choose and opt for that particular position. Okay, so don't abruptly go and join. Okay, let me try this. Let me try this. Don't go abruptly and join there. Choose your career where you want to be in future and which is your. So it is very easy. Like out of 6 years, right? You can certainly come out with, okay, this is my favorite subject, or this is my favorite area. I'm sure all the BPharm graduates at the end of 4 years, they need to choose any one course in M-Pharmacy. So how they're going to be choose M-Pharm course is based on the interesting subject during the B-Pharmacy. For me, the interest was pharmacology. Okay, so I could not get the pharmacology in NIPER, so that's the reason I choose pharmacy practice. So like that, everyone will have the interest, the area of interest. So first of all, you decide which is your area of interest and pursue your career in that particular area, so that you're going to be get the satisfaction, and in the future you're going to be get even the salary satisfaction also. So those are some of the pharmaceutical industry jobs you can opt for. And the people who says that we don't have the government jobs, Pharm D are not having any government jobs. That is not true. There are many government jobs currently, especially if it is related to the pharmacy. Currently, all those organizations, especially calling, we need Pharm D graduates. We need Pharm D graduates. They're calling for that. Why? Because they realize that, okay, Pharm D graduate is one who is having the comprehensive understanding on all the aspects of pharmacy. Because I think you are the only program, the Pharm D is the only program where you're going to be studying all the aspects of pharmacy. So B Pharmacy, they may have only the industry-oriented subjects. And after that, M Pharmacy, they can have only specialization, any one subject. And diploma, it's a very minimum understanding we may have the pharmacy subjects orientation. But only the Pharm D, where you're going to be studying the chemistry, you're going to be studying the SUTIX, you're going to be studying the biostatistics, you're going to be have some knowledge on the core elements like pharmacovigilance, pharmacoepidemiology, and pharmacoeconomics. And most importantly, you are the one having very good experience in the hospital as a clinical pharmacist for providing services to the patients. So you are the one who is having the comprehensive understanding on pharmacy. So you may be the right person to be there in any government organization. That's the reason most of the organizations now calling for jobs, especially they're keeping the qualification for Pharm D. So you can join in the CDSUO. I think that's the highest organization maybe we can see in terms of medications in India. The organization which is responsible for giving the permissions to conduct the clinical trials, to give the permissions to release the drugs into the market, the Central Drug Standard Control Organization. You can be the person in the CDSUO. That's going to be the dream, I think, for many people to work in CDSUO, which is there in Delhi. And some of our students already grabbed. It is not now. It is almost 3-4 years back itself. Some of our students already placed in CDSUO. They're currently working in CDSUO in various positions. Okay, the Pharm D students I'm talking about. So you can be there. The only thing is you should have awareness upon this. Simply no jobs come to you. Okay, no one knows that you are the person studying in maybe Seven Hills College of Pharmacy. This is your name and this is your surname. So no one knows about that. If you are the one, you need to go behind the jobs. You need to search for the jobs. Then only you are going to be get it. And that's a one important organization, maybe where the Pharm D students can work, CDSUO. And one more important, the central government organization where the Pharm D students can fit is the Indian Pharmacopoeia Commission, the one which is the National Coordinating Center for PVPI. Hope you are aware of the PVPI, the Pharmacovigilance Program of India. And for that, all the coordinating is done by the Indian Pharmacopoeia Commission. All of you know this name of this IPC. because that is the organization which is responsible for bringing out the pharmacopoeia which we are using in our experiments. And that's the main responsibility of IPC is bringing out the pharmacopoeia. And in 2010, they got one more responsibility, that coordinating the pharmacovigilance program of India, the one which is collecting all the adverse drug reactions are happening throughout India, right? So either you can be in the IPC itself, which is set in Ghaziabad, Uttar Pradesh. So you can get the post in IPC under the PVPI, or you can maybe in different states where IPC is having another IPC under the PVPI program. There are more than 270 AMCs are there, ADR monitoring centers, we can call them as. So they are the direct positions recruited by the IPC only. And the Pharm D students are the most eligible candidates for joining as a technical associate in any one of the AMCs out of 270. 270 AMCs are there, ADR monitoring centers are there. So all these ADR monitoring centers mostly will be in the tertiary care hospitals. I think in Tirupati also there is one AMC. So like that, there are different AMCs throughout the India. And whenever there are positions, Pharm D students can apply for that, and you can be the technical associate for that AMC, ADR monitoring centers, okay, anywhere in India. And I'm sure all of you know this. You can be as a UPSC, the service agent, like you can join as a drug inspector or a lecturer under the Union Public Service Commission. And Pharm D may be eligible for this drug inspector post. You can apply for that. And lecturer, I think maybe you need to have the PhD and all. But at least if you want to start the career in the government sector, you can try for this UPSC. And similarly, you may have the state government organizations also. In every state, they're going to have the drug inspectors, and you can apply for that, and you can get the even drug inspector position, even in the state government. So you have the option for both central government as well as a state government, and you can choose for this drug inspector position as a government job. And also, you can be the pharmacist in central government health scheme, CGHS, we can call it as. So there you can join as a pharmacist. And here it is not only for Pharm D, even the B Pharmacy and M Pharmacy, other people also eligible to join as a pharmacist under the CGHS, Central Government Health Scheme. And where in the various states, they have a CGHS dispensaries, and maybe you can be the pharmacist in any one of the dispensaries are available around the world, around the India. And I'm sure that all of you know this railway pharmacist. So you can be the pharmacist if you apply. There are many positions are coming nowadays as a railway pharmacist. And starting from, I feel, diploma, or otherwise B Pharmacy may be the starting for getting this railway pharmacist position. And even Pharm D students are eligible for this, getting the railway pharmacist position. And if you are interested to be in the government sector, maybe you can try for any one of these options. So only I'm showing these options. There may be many other which I was not knowing. Okay, whatever the slides I'm showing you today, it is everything comes from my mind. So whatever the options I have seen in the last 8 years for the Pharm D program, those things I kept it here. There may be many other options which I may be not knowing. You can still search for those. You are certainly going to get those options. And you can be in the teaching as well as the research, right? So as a Pharm D is considered as a postgraduate degree in India. It is going to be sometimes undergraduate, maybe till 4th year Pharm D. And after that, you may be considered as a postgraduate student. So because of that reason, you can opt for teaching in any college, in any university. You can be the teacher in the pharmacy college. So Pharm D is eligible for joining as a teaching positions. I'm sure that maybe you are having your own examples in front of you. Some of your teachers could have completed Pharm D in some of the colleges, and they could have joined as a teacher for you in your college, right? So you can opt for teaching if you're really interested in the teaching field, okay? Or if you're interested to do further research, maybe you got some idea during the Pharm D that, okay, this is very good, very interesting. Let me do some research on this area. If you're interested in research, still there are many options to conduct the research, to pursue the research in future, even after the Pharm D. So you can be the research scholar in any of the universities. It may be the government university, it may be the private university. You can join as a PhD candidate, and you can be the research scholar in any of the universities. So either you can join as a full-time PhD candidate, or maybe while pursuing teaching itself, you can do the research, and you can also get the PhD degree. I'm sure that some of your teachers are already doing part-time PhD under different universities like JNTU Anantapur, JNTU Hyderabad. There are many universities which are giving the part-time PhD. If you are interested in both teaching as well as the research, I feel maybe you can join as a teacher and still pursue your career in the research by conducting the part-time PhD. And there are various private universities. They're offering PhD nowadays. You can join directly by attending the interview. Or if you feel that you need some scholarships, you need some money to take care of yourself during the PhD, not to be a burden on your family. In that case, there are various options. Maybe first of all, before even choosing the research career, the PhD, you can write this CSIR UGC NET. That's a Council of Scientific and Industrial Research, which comes under Department of Science and Technology. So if you write the CSIR, if you qualify for that, you can be the research scholar in any of the government organizations, any of the government research institutes, or any of the government colleges. You can opt for the research scholar position, and you are going to get a very good stipend. I feel that the stipend is going to be more than your starting salary, whatever the company it may be, most of the times, because it's a government organization. You're going to get the stipend for every month, and at the same time, you're going to get a very good research profile. I'm sure that if you join as a research scholar in any of the good universities, by the time you come out, your profile is going to be very strong. Okay, so and that's going to be take a lead for your entire career after that. And one more option, I think currently I'm seeing here, it is the Inspire Fellowship, which is once again given by the DST, Department of Science and Technology, for the person who is a gold medalist from that university. So if you are the gold medalist from your university, and you can apply for this Inspire Fellowship, and wherever you are doing the PhD, and you're going to get the stipend, and it's going to be a huge amount. Maybe I think it's more than, if I'm correct, it's going to be more than 30,000 per month. You're going to be get for all the 3 years of your PhD career. That's an Inspire Fellowship, Innovation in Science Pursued for Inspired Research. That's a full form for the Inspire, which is given by the DST, and you can choose that. And you can apply for that. I think for that, you need to first of all join as a PhD candidate in any of the universities. It may be even the private university. And you can apply for the Inspire because you are a gold medalist from the previous university, previous organization, because you are going to get the Inspire Fellowship. So with that, you can pursue your research career once again. So that's about the positions in the research and teaching. You need to choose this only you are passionate about research on the training. Okay, don't choose simply that, okay, because I did not get any job, let me try teaching. Okay, teaching is not that good position, because it's a very difficult position. You need to inspire many other people, because as a teacher, if you are not inspiring your students, the students are going to be once again like you. So as a teacher, we need to inspire. So for that reason, we need to be passionate to be in the teaching. At the same time, as well as in the research also, if you're passionate about the research, then only you can go and join in the research organizations. And entrepreneur. So you don't need to blame anyone that they did not give me the job and I'm not getting any jobs. You can be the entrepreneur on your own. So once I typed this entrepreneur title in my slide, the only thing I got in my mind is this. These are some of the young talented people. The main people are from the JSS. I'm very proud for that. They started the IQ Innovations. I did not take the permission from them showing this photo. Now I'm asking their permission if they're online. So here there are some students, the talented students from Pharm D, and they come together with the help of other professors. They started one of the company called IQ Innovations, and they started building up this particular software. That's a CliniRex. I think some of the colleges in Andhra are using this CliniRex for documentation and for all other internship activities. Certainly, I think all of you are aware of it. And the background behind the CliniRex is only this talented, very young talent. I think they passed out only 2-3 years back from the college, and they come out with this particular software, and which is currently everyone using, and which is, I think, giving out so many ideas even for the teachers how to monitor the students. I feel that. So you can be the entrepreneur on your own based on the ideas what you are having. This is I feel very happy because it is not the new idea. When they were in JSS, we used to have the Google Forms, and we used to have one more software from USA. So there are some limitations in those softwares and the Google Forms, and they grabbed that. They understood, okay, why can't we come out with one particular software which can resolve all the problems which are currently existing in India? So that's what the thought they were having. And once they complete the Pharm D, they pursued that seriously, and finally they come out with this particular the software. Okay, so you can be your own entrepreneur, or if you're not having any ideas, still you want to be an entrepreneur, I feel that maybe you can start your own pharmacy. Nowadays, we can see the pharmacies only they're only meant for dispensing the medication. They don't even talk to the patients. They don't even explain to the patients what is this medication, why the doctor gave you this medication, and what may be the side effects you're going to get once you take this medication. No one is going to have that much time to explain to the patient. So I feel that as a Pharm D graduate, if you are passionate, you can start your own pharmacy. And along with the pharmacy, have a small counseling area where you can provide the clinical pharmacy services, not only the patient counseling. Maybe you can check for the prescription and see drug interactions and see that either the person is having any drug allergies. So talk to the patient so that you're going to get very good satisfaction. So in one side, you're running the business, that's your pharmacy. And another side, maybe you are showing your passion, that is a clinical pharmacist. So that side by side, you can get both the entrepreneur, you can be the entrepreneur as well as you are going to be show your Pharm D talent. Okay, so that can be possible. You can start your own clinic for providing the clinical pharmacy services. Keep in mind that I mentioned clinic, it is only for providing the clinical pharmacy services. Okay, not meant for diagnosis, not meant for prescribing the medications. I think that is also one of the things we need to leave from our mind. I used to hear that, especially the students, when they join in the first year itself, they feel that at the end of 6 years, they are going to be competitors, they're going to be equal to the doctor. Okay, so don't feel that. Everyone is having their own positions. Don't go and you don't want to go and sit in other positions. You have your own position, you have your own career. You are a pharmacist. The doctor is going to be the doctor, nurse is going to be the nurse. So the Pharm D course is started not to say that you are going to be the competitors for the doctors. Okay, it is not possible. It is not going to be possible at all. Okay, it is mainly introduced to say that, okay, the pharmacist can also play a healthcare role, especially in the hospitals. They are not that they're going to be work only in the industries. They can certainly play some role in the hospital, and they can work collaboratively with the physician as well as other healthcare professionals. They can uplift the pharmacy and they can try to improve the patient care. So because of that reason, the Pharm D is introduced. And always you need to keep in mind that you are not the competitor for anyone. You are the person for pharmacy, and you're going to be working in collaboration with the doctor, nurse, and other healthcare professionals. So finally, you need to think that your presence should make a benefit to the patient who is coming to the hospital. Okay, that's your role. That we need to keep in mind. And fellowships, there are various fellowships. If you don't want to pursue your career right now, you don't want to be in job, you want to maybe undergo some fellowships and gain more experience towards a particular area, there are various fellowships that are available. I was very happy seeing this recently, this particular notification from Tata Memorial Center, the Advanced Center for Treatment and Research and Education for Cancer. And they have released recently on 19th June. So there's a one-year fellowship in oncotherapeutics. And I was very happy to see this, the qualification. I've mentioned the qualification is only two. One is either MD Pharmacology and another one is Pharm D. I was very happy to see this. At least they treated us, Pharm D is almost equal to the MD Pharmacology. That's the reason they offered both, either MD Pharmacology or Pharm D. So people who say that we don't have any jobs, no one is considering the Pharm D, this is one good example to show. I know that all of you know this Tata Memorial Center, how much prestigious institutions they're having in India. And getting a chance there is going to be the ultimate, right? Especially for the fellowship programs like this. And the better part is you can see how much remuneration you're going to be get. For the post of Pharm D, you're going to be get almost 53,000 per month. It is not even a salary of a 5 years experienced person in any industry, I'm sure. Okay, so 53,000 per month is not that easy. So if you selected for this, the only thing is here, once again, this is the job only for 1 year fellowship. You're going to get very good experience. And I feel that there is only one position here. There are not many. Okay. So there are positions. The only thing is, if you have the talent, if you can grab that, obviously the job is going to be yours. Okay, you should get the talent during your 6 years. Then only you're going to be achieve that. Okay, otherwise it is not that simple to get that one job. Over 1,000, maybe they may be getting thousands of applications. So among that, getting that particular job, certainly we need to have a talent. Then only we are going to be get it. And I have seen some other Pharm D fellowships. This is the one from BMS, Bristol Myers Squibb. I have seen in the website. So they clearly mentioned that once again they're offering the fellowship programs for the Pharm D people. I did not go through the full content, what exactly is going to be, but certainly you are going to get the industrial exposure, which is meant mainly for the Pharm D people. That's going to be a very good option, maybe to choose if you want to be expertise in that particular area, maybe in industry. And similarly, I have seen this fellowship in oncology pharmacy, which is given by the SCC. SCC, I'm not sure how many of you are aware of it. It's one of the leading oncology hospitals in India, SCC, and they have started offering this fellowship in oncology for 12 months. And for that, the only eligible qualification is the Pharm D. So Pharm D degree from a recognized university is going to be eligible for that. So they're going to be give some fellowships. Fellowships means you are going to be get the money. You are working, you are a trainee, you are going to be working initially for that organization, but still they're going to be pay you while pursuing the fellowships. They are going to be pay you. You will get the pay as well as you will get the very good experience in that particular area, and that is going to be very much useful for you to pursue something further in your career. So once you complete these fellowships, it's very easy to get jobs in any of the companies where you are interested. And similarly, JSS University is also offering, JSS Academy of Higher Education Research also offering the residency program. And that's once again first in India, they're offering residency program. Currently, we are having residency program in 2 important areas, that is oncology and nephrology. And soon we are coming out with a few more branches. So the residency program is mainly meant once again for the Pharm D graduates. So if you are a Pharm D graduate, you can apply for the residency program. And here once again, only there are 2 seats per branch. Only there are 2 seats, and there's a huge competition here. Once again, you need to apply for that. You need to attend for the interview. If they feel that okay, you are the potential candidate, they can take you for that position. So here, this once again, you can be the specialty pharmacist. So at the end of the Pharm D, everyone is going to have the same level of understanding. Okay. If you want to be specialized in particular area, or if you want to be a specialty pharmacist for oncology, a specialty pharmacist for nephrology, maybe then you can go and choose this residency programs offering by JSS University. Currently, only JSS University is offering this residency program for Pharm D. Maybe in future we may expect many other universities are offering. And don't once again bother. Okay, Pharm D, for Pharm D only there are no. I used to hear that for Pharm D only there are no jobs. So where this residency program people are going to be joined? It is completely not true. If you want to be a clinical pharmacist in the SCC, only with the Pharm D qualification, you are not going to be get that position at all. You need to have the additional qualification. At least you should be an MD pharmacology, or otherwise you should be a residency candidate, or maybe you could have get this fellowship in oncology. So then only you are going to be get the position in the SCC or any other corporate hospitals. If you get a highest qualification, certainly there will be an advantage of being there in the organization. And as I mentioned, nothing comes to you, nothing comes to your laptop. We need to search for that. Then only we can get the options. There are various ways of getting the information on all these things. Whatever I mentioned till now, all this information will come to you, but you need to follow them. So if you follow them, then come to you. How you're going to be follow all these options? Like we have various resources to follow all this. I'm sure all of you know this Pharma Tutor, one of the leading website where we can get almost all the information about the pharmacy and the pharmacy related job opportunities. So you can just go there and register yourself, keep your mail ID. They're going to be sent you all the updates on daily basis. So you can see various positions are available currently for pharmacy, not only for Pharm D, for pharmacy, various positions are available, and all this information you can get it from the Pharma Tutor. It may be for the lecturer position, it may be in the government organizations, it may be in the company. So you're going to get almost all the information related to the jobs related to pharmacy. You're going to get it from the Pharma Tutor. So like that, we have various websites where you can go and keep your mail ID so that you're going to get the alerts. Like we have a Pharm D info, which is developed by one of the staff member from JSS College of Pharmacy, Ooty. Once again, meant for the Pharm D students especially. So where you are going to get all the Pharm D related information. It is not only the jobs. I think here you are going to get even the materials also here. For I think already there are every subject there are materials are available in the Pharm D info website. You can just go and collect those materials and you can study those so that you can gain the knowledge in that particular area. And the Naukri.com, everyone knows about it. It's not only for pharmacy, but still you can get some pharmacy related updates from the Naukri. And there are various other websites are there, like Pharma Job Portal. And most importantly, like how you're maintaining your Facebook profile thoroughly and how you're updating your profile. So similarly, if you update your profile in the LinkedIn, if you are having or not the Facebook account, you should have the LinkedIn account. Okay, so LinkedIn is also similar to the Facebook, but it is mainly meant for the professional activities. And if you create your CV there, maybe the people can look at your CV if they feel that you are the suitable person for them, and they can take you into the positions. Or another way is you can follow many other people through the LinkedIn, and you can see if there are any positions related to you, and then you can communicate to them so that you can get the option. So one of the very important website where you can go and create your profile. So that's going to be very useful for your, at least the starting career is going to be very smooth if you have a LinkedIn profile. Okay, so these are only few. I'm sure that if you go and search, you're going to get many other. And what I request you is you should keep updated. If you're not updating yourself, you're not going to get any other new information. If you're not getting any new information, you may not grab into the position where you are looking into. So you need to update yourself. First of all, you need to show the difference from you to other. You should be the special. Okay, so then only the people are interested to grab into the positions. We are having the campus placements in JSS University, JSS Academy of Higher Education Research. So whenever the people come for the campus placement, they will call everyone. They don't restrict, it is only for Pharm D, it is only for pharmacy. They will call all the people who are graduates. And finally, they will see that either the person is having the talent or not. They will see the, first of all, skills. The knowledge may be the secondary. They will see the skills first. If they feel that the person is having the skill, the person may be from pharmacy practice, person may be from pharmaceutics, they will take. And anyway, if they take from pharmacy practice also, if they take from pharmaceutics also, they need to train the people. Without training, no one is going to be directly work in the company. They need to certainly give the training. So what they're going to look into is, once they give the training, either the person is capable to perform whatever they're expecting. That's what they're going to be seeing in the interview. If they feel that the person can perform, they're going to be take any person. So here what we need to understand is more than the Pharm D degree, more than the M.Pharm degree, more than the B.Pharm degree, we need to have the skill and knowledge. Then certainly we are going to get the job, whatever we want to be in the future. So that's what from my side. I hope I have done the justice by giving you some information, especially for the newcomers into the Pharm D, showing that there are opportunities. Don't bother now only that you're not going to have any opportunities. It is up to you. You need to build your profile. Then only you're going to get the jobs in any of these organizations. So finally, I would like to end with the quote by Dr. APJ Abdul Kalam. Without your involvement, you cannot succeed. But with your involvement, you cannot fail. Right? So certainly we should involve. Then only we are going to get the success. So without involvement, don't expect any success in your career. So thank you so much for attending today's webinar. Hope it is useful for you. And it is only the basics. Maybe if you want to have more understanding on this, you need to go and search for various websites and various organizations so that you are going to get more and more information. So please contact me if you have any other questions or any other related information you need. Please contact me over mail. I'm very happy to reply back. So one thing I'd like to thank the organizers for giving me this opportunity.
Yeah, thank you so much, sir. It's a very great session for us. You have enclosed many various opportunities regarding Pharm D. So, like one thing, oncotherapeutics fellowship program you have said, that was a very amazing opportunity. We can try for that. So here, some of our students have directly in a contact with you through the live session. Only two students was there. Then we will go for the YouTube chat session. Okay, sir.
Sure. Yeah.
Okay, sir. Now I am requesting Divya, graduate from the Pharm D graduate. She will answer. Okay. Thank you, sir.
Good morning, sir.
Yeah, good morning, Divya.
Sir, it's very great to hear many opportunities. We actually we don't know about that, and we don't know about these government jobs also. And we are very pleasure to hear about this. Thank you so much, sir. And I had a doubt, sir. And
Yeah,
I
please.
have seen many opportunities related medical writing, sir, but most of them require experience. So, how can a fresher start in a field like medical writing? And is there any skills needed for that?
For the medical writing, even though some of the companies they will ask experience, maybe at least 2 years experience they will ask certainly. But there are some
Yeah,
companies
sir.
where they can take even the freshers. Okay, so maybe the companies which are multinational companies they may request experience, they require experience. But there are some companies where they can take even the freshers. They may be the small companies, but we need to start there. And otherwise the other chance is some it is not always they will go with experience only. They will see the how much knowledge and how much skills they are already having. So what you can do is, if you during the 6 years you're going to be have so much time, especially in the fifth year and sixth year you're going to be have so much time, and try to publish at least 2 or 3 papers, reviews also, review articles or the research articles. Try to publish some articles. At least people knows that you have some, even though you did not have the experience, but during your family itself, you have done some publications. So they knows that, okay, writing skills. So publication shows us our writing skills. And if you have the good publications during your family itself, they certainly feel that, okay, you are having some understanding already. If they don't feel that they have any other person who can compete you, certainly they're going to be take you. The experience they will give only in the notification, see that, okay, at least they are going to be get the people who are having experience. Certainly no one is going to be stop you to apply for that. You can apply for that. If luckily, if they see your profile, if they feel that your profile is very good, you are already having the publications. If they call you for interview, attend the interview, and if you can perform well, certainly the job is going to be yours. Either you are having the experience or not, that is secondary. But we should have the skills and knowledge as well as the writing skills. Then we are going to be get it. There is no problem in it.
Okay. Okay, sir. Okay. Thank you, sir.
Yeah. Thank you.
Yeah, thank you, Divya. I think you have your doubt has been cleared. Thank you so much. Thank you so much, sir. We have one more student, Snehita Tiruvalla from third Pharm D. I'm requesting to Snehita to come.
Please.
Snehita, just unmute your mic.
Hello, sir. Good morning.
Yes,
Yes, yes,
Nahita, good
right.
morning.
Thank you, sir. So first, yeah, sir. First of all, I would like to thank sir for conducting this session and letting us know the about awareness and all these variety basic streams. Thank you, sir, for that. But I have a few questions to ask about, sir.
Please,
And my first
please.
question is, what are the main opportunities for PharmD as drug advisor or pharmaceutical advisor, sir? Like, what are the different opportunities to enter that?
Yeah, I think drug advisor and all, they're somewhat bigger positions as I feel, and just a PharmD graduate may not going to be select for those positions, the drug advisors, and even the in companies we have one more important position called medical affairs. That's also like almost like a drug advisor, and currently they are taking the MD pharmacology people for that for those positions. PharmD, they are not at open for it, but certainly there is an talk is going on. Even this one company visited JSS College of Pharmacy and they have seen how we are training the PharmD students and what all the skills and knowledge we are getting during the PharmD. They have seen all those. They mentioned that they may try in that company. They may try initially trying to take this PharmD graduates also for that position. But certainly at present, I think companies are not accepting the PharmD for that. Not accepting in the sense they feel that that may be the very minimum qualification to get into that position. But maybe if you join any other fields, related fields initially, like medical writing, regulatory writing, if you are there in that position initially, and with that experience, maybe you can get that job in future, but not as a direct PharmD students, you can get that particular positions, the drug advisor and the medical affairs.
Okay. So I also had one more doubt. Like,
Yeah, please.
like right now we are in third year. So respective in fifth and sixth years, we'll be having more time so that we can explore. So there
Yeah.
are any courses that we can probably like short courses or crash courses kind of things that we can complete before entering our job session? Like we have any opportunities or what? I just wanted to know, sir.
Yeah, that's a very good question. Thank you for that, because I did not address that during my presentation.
Yes,
As
sir.
I
Thank
mentioned,
you.
there are more than maybe 300 colleges for PharmD, and each
Yes.
college may have 30 students every year. Okay, so there are many students are coming out every year PharmD. Okay, so to get into our dream role, we should be something different, right? We should be
Okay.
extraordinary. So the
Sure,
difference
sure.
between extraordinary and ordinary is only that extra, right? We need to have that extra. Then only we can be opted in our dream role. So that extra can be of all these the short courses and other certificate courses, whatever we are going to be do during our PharmD itself. That's a good question. As I said that in fifth year, especially in fifth year and sixth year, why I'm saying fifth year and sixth year only because at least by the time you come to fifth year, sixth year, you know what is there, what is going on in PharmD. Initially, yes, I'm very sure that okay, they may be even new for pharmacy itself, and doing a short courses and all, it's not that easy. At least when you are in fifth year, sixth year, there are various short courses are available, and nowadays India is very good in that giving the online short courses, especially the organization called the MOOCs, MOOCs,
Yes.
and we can also I think there is one more similar one called NAPTEL, NAPTEL. Okay, so this MOOCs and NAPTEL coming from the central government, they're offering various short-term courses, various certificate courses, and which are given by the reputed organizations in India, like IITs, IIMs, and these are the organizations that are involved in giving those courses. If you feel any, it may not be pharmacy. Okay, don't expect that you may get the course on pharmacology, pharmacotherapeutics. They are going to be something different. So if you feel that maybe something which is interesting for you, for example, biostatistics, maybe based on your experience in PharmD, you feel okay that maybe your interesting area. There are some courses on biostatistics. You can join for that. They will teach you very well for the 3 months time, and they will give you many assignments. And at the end of the 3 months, they will conduct one examination. You need to go and write the examination. So once you qualify, you're going to be get the certificate that you are done this short course, and that certificate is going to be very valid because you are going to be get that certificate from the reputed organization as well as from the central government. So that's going to be the added value for you, maybe when you go
Providing.
on pursue your career, and that's the one. And maybe you can go and try for any PG diploma courses are available. The postgraduate diploma courses are available in any of the Indian universities, or maybe abroad. There are many universities that are offering postgraduate certificate courses. If you see that some of, maybe especially on pharmacovigilance, pharmacoeconomics, and pharmacoepidemiology. So these are some of the interesting fields. Maybe you can get the PG diploma courses. If you find any of the PG diploma courses, you can certainly opt for that, do those courses, try to get some more understanding than what you are getting in the college. So that's going to be certainly added value for you. And that's going to be give you more weightage for your CV. So you can keep all these things in your CV. And when you send the CV to the company, so they are going to be looking into all these things. And certainly there's going to be a more weightage.
Okay.
So I request all of you, please pursue that. Maybe you can take those courses based on your interest, and that's going to be certainly added value for you.
Yes, sir. Thank you
Here
so much.
at SS University, we are having the certificate courses, we are having the PG diploma courses, and even we are having some online courses also. And most of our family students, especially when they are in fifth year and sixth year, they're going to be pursue those certificate courses also. And when they go for interview, those are going to be added value for them, certainly.
Okay,
Is
sir.
that
Thank you very much, sir.
Thank you so much, Snehita, for your very initiative queries. Thank you so much.
Thank you.
And thank you so much,
Thank you.
Krishna sir.
Also, thanks for,
Yeah,
yes.
thank you for giving that question.
Yeah,
Yeah.
thought was somewhat unique,
Yeah,
like.
it's a very good thing. Yeah.
Yeah,
Yeah.
thank you
Now
very
we'll
much.
go for some
Thank you.
YouTube chat box questions, sir.
Yeah, yeah, please.
Okay, sir. Sir, can you see
I
the
can see.
question? Yeah.
For a job in government sector, should we have to register as a pharmacist, or we can enter into the field while we are in intern? So it's very clear. The question is very clear, and answer also is going to be very clear.
Yes.
You are studying till you complete your Pharm D course. You are the student only. So you are not going to be joined in any company, any organization. Okay. So you need to complete your 12 months internship certainly. And once you complete the internship, you need to get the certificate from your college that you have completed the Pharm D. And with all those certificates, you need to go to the pharmacy council and register as a pharmacist. And especially for a private sector, they may not bother your pharmacist registration. But if you want to apply for any government jobs, certainly you need to be a registered pharmacist in any of the state pharmacy councils. You may get the job during your internship only, like whenever you go for the campus placements or off-campus placements. Whenever you go for interview, you may get the job, but you're going to be joining the job only once you complete your internship, because as per the PCI, the Pharm D students that should certainly undergo 12 months internship. So that 12 months internship is very, very much requirement. And after that only you can go and pursue. And for private organizations, you may get the registration maybe later, but for the government, if you're applying for any government jobs or any other government organizations, certainly you need to be a registered pharmacist.
Yes, sir. One more question, sir.
How to get in ICMR scientist position, whether ICMR scientist positions is government or contract-based jobs, sir? Could you please explain in detail? So for ICMR positions, once again, ICMR having, it is not only ICMR, ICMR is having various other research institutes in various places, like we have ICMR, National Institute of Epidemiology in Chennai, National Institute of Virology in Pune. So like that, there are various ICMR institutes are there in various states. So you can be the research scholar in any of these organizations, but for that you need to write an examination. I think CSIR net is required for to join as a research scholar in the ICMR, because it's a government organization. Certainly we need to be qualified for CSIR, and then maybe you can join as a research scholar in any of the organizations. And it's a government or contract based. All the government organizations initially they're going to be give the contract based jobs only, and later if they feel that there is a vacancy, then you can be the permanent position. Otherwise, initially it's going to be the contract position. Especially the research scholar, certainly it's going to be the contract based only, because you are going to be there only for 2 years or 3 years till the end of the project. So certainly it's going to be the contract based.
Sir, one more question.
Does knowing the pharmacophore or pharmaceutical agents help with any field in the practice of pharmacy? Unless otherwise it is not related to pharmacy, then we don't need to bother, because wherever something pharmacy is there, like this pharmacophore and the pharmaceutical agents, all these things are very much important even in the pharmacy practice, in the community pharmacy also, because whatever you're going to be learn in the 6 years, somewhere it is going to be useful. People usually feel that, okay, I'm doing Pharm D, I'm going to work in hospital or I'm going to work in community. So why I need to study the chemistry, why I need to study the pharmaceutics, they feel that. But as a pharmacist, as I mentioned, that's the advantage of Pharm D, because you're going to be study the comprehensive pharmacy. Okay. So as a Pharm D graduate, you should have at least a minimum understanding of all the pharmacy related areas. Maybe if someone asks you any queries, even though you're working in a community pharmacy, if someone come to you, what is this? What is the formula of this? What is the chemical structure of this? At least you need to be able to explain that. As a pharmacist, that's your role to explain that. So for that reason, certainly all the pharmacy related fields are very much important for us.
Sir, one more question, sir.
Yeah. LLB course. Later, can I work as a legal advisor for pharmaceutical companies along with my registered pharmacy certificate? So I think that's going to be happen. You can be the legal advisor for the pharmaceutical company, and you're going to be the best person also because you have a pharmacy knowledge, and also you are LB, so you're the right person to be a pharmaceutical company as a legal advisor. That's going to be possible.
Yes, sir. Thank you. And one more question, sir. Money is
Yeah,
there.
please. Yeah, no problem at all. I can take much time also, no issues.
Oh, thank you so much, sir.
Which area we will get jobs. So the area of job is going to be entirely depends upon in which area you are doing the fellowship program. For example, if you do the fellowship program in oncology, by showing that you can join in any of the companies which are mainly working for the oncotherapeutics, which are mainly working for the oncology products. You can show that you have a fellowship in oncology, you have done 1 year fellowship, certainly you're going to get the job in that particular field. If you do any fellowship, maybe in industry like BMS, what I shown, Bristol Myers Squibb, if you say that you had a fellowship from that BMS, you're going to be offered in any of the other multinational companies because you have a fellowship from the Bristol Bristol Myers Squibb. So like that, it is entirely depends upon which area you're doing the fellowship, and in that particular area, maybe you can pursue further. So one thing I advise you is, once again, fellowships also, don't take the fellowship whatever you are getting. First of all, see that either you are interested in that area. If there is a fellowship in oncology, if you are not interested in oncology, don't go and join there. Because if you do the 1 year fellowship in oncology and come and work as a pharmacovigilance area, pharmacovigilance associate, then there is no meaning in that 1 year fellowship in oncology. So if you want to do an oncology fellowship, certainly you need to be working in that area in future. Okay, so choose the fellowships like that. Then based on that, you can choose your career.
Yes, sir. One more question, sir.
Yeah. Could we craft career as a clinical pharmacologist? There is no difference actually, the clinical pharmacologist and clinical pharmacist. In MBBS, because they're having the clinical pharmacology, they will call the position as a clinical pharmacologist. And because in a pharmacy, we are studying as a clinical pharmacy, we will call it as a clinical pharmacist. Okay. So the clinical pharmacologist can be the person who done MD in pharmacology, and the clinical pharmacist can be the person who done Pharm D or maybe M.Pharm pharmacy practice. Okay. So otherwise, both the roles and responsibilities are going to be same in any hospital. So it can be the clinical pharma. If they give the qualification, okay, like what we have seen in the fellowship, which is given by the Tata Memorial, where they both MD as well as the Pharm D. So something is like that, then maybe you can opt for it. It may be the clinical pharmacologist, it may be the clinical pharmacist.
Yes, sir. One more
It's a
question.
very good career, I feel. Yeah. Is PhD required Pharm D for entering such field? Certainly, for the PhD itself is a research. After Pharm D, if you are interested in research, then only you can pursue PhD. Otherwise, if you want to be, maybe if you want to go and join in any industries, I think PhD is not mandatory there. If you want to be in teaching or if you want to be in research career, I think certainly the PhD is going to be mandatory. Mandatory in the sense that's going to be give you more options if you do the PhD. It is better to do an MBA in hospital administration or as doing PhD and enter the research world. So here, once again, it depends upon up to you, like either if you want to be in research or you want to be in administration. I think both are going to be completely different. Completely means completely different. So if you want to be an administrator, then maybe you can certainly do the MBA, and I think that's going to be more valid. After Pharm D, if you do MBA, you can grab the jobs in corporate companies in the administration section. Or if you want to be in research, if your passion is research, maybe then you can go on opt for the PhD. So anything is fine, but only thing is it is up to your interest. Either you want to be an administrator or you want to be a research scholar. Certainly, the pharmacoeconomics. Does we have a role in pharmacoeconomics?
It's genomics, I think.
Sorry, it's a pharmacogenomics. The pharmacogenomics, usually the people, they will consider the person from biotechnology group, the person who done maybe MSc or BSc in biotechnology in pharmacogenomics. For pharmacy, as I mentioned, no, it is up to us. If you have some understanding on the genomics, or maybe if you've done some certificate courses on this pharmacogenomics, maybe you can get the particular research area in pharmacogenomics. But otherwise, only with your PharmD qualification, you are not suitable or you are not eligible for the pharmacogenomics. Only with the PharmD qualification, because I think not even a single subject we are having on pharmacogenomics in our entire 6 years PharmD. So as such, PharmD, you're not eligible for that. But if you have any additional knowledge and additional courses if you have done on that area, then maybe you are eligible for that.
One more question, sir.
So other PharmD opportunities abroad, that's the one I did not cover here.
Yes.
Why I cover here is I'm sure that you could have heard from many people about the PharmD opportunities in abroad. And one of the person requested me yesterday, one of my senior requested me yesterday, please speak about the Indian perspective, because I feel that no, the dilemma is there currently about the Indian opportunities. That's the reason my entire presentation I kept it only for the Indian opportunities. I did not speak anything on abroad, but certainly there are options for abroad. Maybe my experience only I can give my own students who pursued PharmD from JSS. Many of them are there in US, UK, Australia, and other countries. Certainly there is an option, but only thing is all of them did not go directly for a job. Don't expect that with the PharmD qualification, what you are having here, it is going to be lead you to get a job in one of the company in abroad. That may not be possible, may be possible in only rare cases, but don't expect in all the cases. So that's the reason what all the people, all the students will do from here is they will try to go to USA, saying that they're going to pursue the masters after this PharmD. So they will join any master's course there. So while doing the masters, they will write the NAPLEX, and before that they will write the FPG, and then they will write the NAPLEX, and then they make a settle as a pharmacist there. If they're not interested to settle as a pharmacist with the qualification of PharmD as well as with the qualification of masters there, they can choose any other related fields in the US itself, and they can settle down there. So obviously, the PharmD degree, whatever you are having from Indian universities, it is going to be valid there. But it is going to be valid in the sense it is not for may not be for directly to the job. It may be for valid for pursuing your career there as a master student.
So one more question, sir.
Yeah. So please explain about the pharmacovigilance courses offered in universities and about government jobs in pharmacovigilance. So the pharmacovigilance, as I mentioned, the courses wise, if you speak, once again, in the entire PharmD curriculum, there is no subject on pharmacovigilance. Okay, I'm sure. But you are going to be studying some concepts of pharmacovigilance in pharmacoepidemiology and other subjects. But as such, you don't have any subject on pharmacovigilance. What I feel is if you are interested in that area of pharmacovigilance, there are various courses are available currently on pharmacovigilance. Especially, I suggest one of the very good organization that's going to be more valid also if you keep that in your CV. That is Uppsala Mounting Center. We can call them as UMC, which is there in Sweden. Uppsala Mounting Center. If you go and search for the website UMC, they're offering various certificate programs. Certificate programs means maybe there are 1 week lectures or 5 to 6 lectures will be there. You need to attend all those lectures. At the end of the lectures, you need to write. Maybe you need to perform the examination. Examination means they will ask some questions. We need to answer for those questions. And once you do that, you're going to get the certificate from UMC. That means you have completed that certificate course from the Uppsala Mounting Center. So whenever the term pharmacovigilance comes, the ultimate term which comes in our mind is the UMC, Uppsala Monitoring Center, because that's a very reputed international organization for the pharmacovigilance. So if you have the certificate from that organization, that's going to be certainly valid. Okay, so that's the UMC's one. And apart from that, there are various universities are offering nowadays for PG diploma courses in pharmacovigilance. Such for the universities, even JSS is also offering a PG diploma course in pharmacovigilance, online course. And maybe you can search for that, you can apply for that, so you can get the certificate from the university. And later, because you are having the certificate, you may be the right person to choose in any of the pharmacovigilance company. So you can be grabbed.
Sorry, sir. One second. One more last question, sir. That
Yeah.
will.
Scope of MBA after Pharm D is being answered already. That you will get.
I think it was answered, sir. One. Sorry.
Yeah, this I answered already. So that's why afterwards, to do the MBA, maybe it's going to be much better actually.
Yeah, with this we will wind up, sir.
Brief description about clinical pharmacist opportunities. Yeah, as I mentioned, my initial slide itself, there are opportunities for the clinical pharmacist. I think that is a dilemma which is going among the Pharm D students. There are no clinical pharmacist jobs. Okay, there are jobs. I have my own students. I feel at least 10% of the graduates are joining as a clinical pharmacist. At least from my college, 10 of them are joining as a clinical pharmacist. Especially in Kerala, we'll get most of the Kerala students, and they used to have the clinical pharmacist jobs in their own hospitals, private hospitals. And nowadays, it's going to be the job opportunities have become more because most of the hospitals they are going for that NABH accreditation. Most of the hospitals they want to try for this accreditation, and for that reason, if they want to apply for that NABH accreditation, certainly they need to have a clinical pharmacist. Even though the reason is NABH, but certainly if you get the job there, if you prove yourself, that means if you prove that your presence makes difference in the hospital, and certainly you are going to be there in that position, and you may be the first person which is leading the other people. If you show that okay, your presence is there is a added value, they may come out with more and more positions in the future. So your juniors and other founding people also can get the jobs. I think the person who is leading is important. Okay, at least one or two people should lead in front, and then only the other people can get the options. Certainly, there are jobs. Don't think that you don't have the clinical pharmacist jobs. There are there. May not be the government jobs, but private sectors, there are jobs are available.
One more thing, sir. Actually, it was a very great session. We have many ways I have find out today. Actually, from my side, I can say. And
Thank you.
my personal question was, no one was asked
Please.
about academician, like how we can grow in academic field. Can you clarify?
Okay.
Means it will be full fledged, I think.
Sure. Certainly. In academics also there is a lot of growth. Even though initially we may join, okay, because we don't have any job, let me join in a college, let me teach for some time. Because even my career started like that. Okay, we don't know our talent till we come into that academic field. Because I'm sharing once again, first time after I done my diploma in pharmacy, I done all the pharmacy related courses like diploma, B pharmacy, M pharmacy. Except Pharm D, I have done almost all the pharmacy courses. So after I completed my diploma in pharmacy, I did not get the rank in ESET where we need to join for B pharmacy. I did not get rank. So that's the reason I was thinking, and luckily my diploma college principal say that why you are going to be waste 1 year, come to college and try to teach your juniors. Like as a tutor, you can come and teach your juniors. So why you want to waste your career? So I opted for that, and I have done 1 year teaching there in diploma college itself. And that time I realized that, and that's the first time I realized that I'm going to be in the teaching field. Whatever I'm going to do in the future, maybe B pharmacy, maybe M pharmacy, maybe PhD, I'm going to be in the teaching field. That time only I decided. So maybe you could have also come like that. You could have joined. I don't know, either it's your passion or you have joined in a college. But when you're teaching, if you feel satisfied, you're getting the satisfaction, and
Exactly, sir.
certainly there's a career for you in the pharmacy, in the pharmacy as a teacher also. And as I think you know that in the pharmacy teacher there are various positions. Once again, you may be the assistant now, you can be the associate professor, you can be the professor, the principal, so head of the department. So various positions are there, and once again it is up to us how we are going to be take it up. And here certainly once again the Pharm D qualification alone may not be sufficient to grow further in the teaching field. Certainly we need to have the PhD. So soon, I don't know you registered already or not for PhD. If not, PhD is going to be the mandatory, and maybe nowadays there are government universities are coming out with this part-time PhDs and all. So maybe you can try for those part-time PhD and you can do your PhD. So after that, certainly there will be career. The only thing is we should like our profession. If you like teaching, then that's it. So you can be there. And remaining all are, yeah.
Thank you so much, sir. It's just like a very useful session. Nowadays, most of the Pharm D students is having some career dilemma, like, so where we need to go, where we need to start our career. They have some clashes in their thoughts itself. So I think this session have enlightened, so they can choose the career frankly, we can say. So thank you so much, sir, for your valuable experienced speech. And now, what of thanks. Yes, sir. Now,
And
the
I
vote of
request,
thanks. Yes, sir.
and I request all the teachers also. I think the main role is on teachers. Even though I come once in a while and speaking in the YouTube may not impact much. And now the role is on the teachers of Pharm D. At least,
Exactly, sir. Exactly.
They should speak positively. There should not be any negative thoughts. They should speak positively whenever they go to the class. I think then they're going to be change the life of the students. I think the entire thing is on. So we should be the role model. You have done your Pharm or M pharmacy. Sorry
Pharm D,
for
sir.
asking.
Pharm D only.
So that's what you should be the role model for your students, and you should be giving the positive attitude and positive thoughts to the students. And obviously, the students are also going to be like that. The only thing is coming from a negative side. I think once we keep that negative outside out, obviously the positive is going to be there.
Yes, sir. Exactly. Thank you, sir. Thank you so much. Now, vote of thanks by Dr. Uma Maheshwar Rao, sir, Research Director of 7 Hills College of Pharmacy.
Thank you very much for coordinating. Thank you very much.
Thank you, sir. Thank you, sir.
Yeah, very good afternoon to all of you. Firstly, it's my great pleasure to acknowledge the valuable guest lecture in this session. I sincerely thank Dr. Krishna Undella Garu for your valuable address on the career opportunities for the Pharm D students. After seeing your resume, I was wondered like how far you have traveled to various countries like China, Japan, Taiwan, Hong Kong, and Australia, the number of travel grants you have received from the government, and the number of guest lectures you have given, the number of publications what you have made out of your experiences. All these experiences we could clearly see in your presentation here today in our session. I sincerely thank you, sir, for accepting our invitation and enlightening our students very elaborately regarding the career opportunities. And secondly, I sincerely thank all the participants. Nearly 300 participants have came into the live session. Though there were more than 1,000 registrations, this session would have been very useful to all the participants. I sincerely thank all the participants for showing the interest to join our session in this webinar to make it as a grand success. And I sincerely thank our management, chairman and principal, Dr. M. Niranjan Babu Garu, for giving us an opportunity to have this webinar on today with the delightful presence of our Dr. Krishna Undella Garu. And last but not the least, I will fail in my duty if I do not thank our team members, especially Pharm D coordinator Dr. Jyoti Garu and Dr. Sunil, Dr. Sirisha, and all other faculty members who have strived a lot for the past 1 week to make this program in a very grand, successful manner. I wish all the best and all the regards to the participants as well as the Krishna Undella Garu. Thank you so much.
Thank you very much, sir. Thank you for giving the opportunity once again.
Thank you, sir.
Yeah. Thank you so much, sir. We will get back to you again.
Sure, sir. Certainly. It's my pleasure to be there. Thank you once again for giving me this opportunity. I hope I have done my justice today, so I can go on.
Yeah, it was really very nice. We can say I need to say many thanks for that.
Thank you very much.
Thank you so much.
Sunil, thank you, Jyoti madam, for organizing this.
Yes.
Hope it is useful for all the students. So I'm there with you for anything.
Yeah, sure, sir. Sure, we will. Thank you, sir. Yeah, all of the delegates, all the link and we feedback form and certificates will be mailed to your respective mails. And who have missed the YouTube session, that link also we will mail to your respected mails. It will take 1 week mostly. So I think it has been a very great session for all the delegates. We have inquired your doubts, and many of them clarified their queries and all. So Seven Hills College of Pharmacy is straight for forthcoming to do many more things like this, and it will make continuing in this webinar condition. Thank you so much, delegates, and we will get back to you shortly with another webinar. Thank you so much.